So my icon in that space is Steve Jobs. And about a year and a half ago, I did a complete riff on why Steve Jobs was important to healthcare, even if he didn't know he was important to healthcare. And the concept was that Steve was looking, Steve, like I know him, but he was looking for how do we get more people engaged in what gives them satisfaction and also drives the Apple products. So we want to do both. And that's exactly my message to employers, to health plans, to docs, to health systems. How do we get more people enjoying the experience instead of having fear? How do we get them to behave better when the experience is over? Because healthcare is really a 24/7 kind of mindset, and yet you don't want to wear people out. How do we align the incentives so everybody gets a win when a patient and a doctor interact? So that's the holy engagement piece. Now, how do we take what they do together and expand it so that the whole healthcare system reaps rewards and the communities get healthier? And my story on that is the explanation of when Steve Jobs created the iPod. That was his first big piece. Remember all the failures that he had? What he did was he made an interface that was engaging. He learned that and built on it and put it internal to himself when he was at Pixar. So Pixar, which looked like a diversion, was an incredible learning lab for him. And then what he said was, I want to take that kind of learning and I want to put it in places that people don't even know they need it. So we all had MP3 players, we had Walkman, we had all kinds of stuff, right? But now we've got an iPod, and it was so cool to have the iPod. And my role now is to say to people, is that cool if we do that? Do people think that's cool? Do people think that going to the hospital for a test is cool? Well, they would if we explained to them what's at the end of that test, how they get better, how their families benefit, how they can give back to the community. It's a story that links people to other people, and that's how we keep moving forward.